Imagine dedicating your entire life to saving others. Years of training, long nights in hospitals, countless lives touched. You're a doctor, a healer. Now imagine one day, when someone you love needs urgent help, you rush to the emergency room, only to be treated like a stranger, to be doubted, to be denied care. This is not a story from decades ago. It happened recently, to a black doctor. Dr. Marcus Williams had just received a call. His mother was struggling to breathe. Without hesitation, he grabbed his medical bag and drove straight to the nearest hospital. He arrived quickly, wearing his scrubs and ID badge. You'd expect doors to open wide for a doctor rushing to save a life. But instead, the hospital staff stared at him with suspicion. "Are you sure you're a doctor?" a nurse asked coldly. Despite his credentials, his years of service, and the urgency of the situation, they questioned him. They doubted his presence simply because of the color of his skin. Dr. Williams found himself fighting not only for his mother's care, but for his own dignity. He was asked to wait outside while they verified his identity. Precious minutes passed. His mother's condition worsened. Inside, the hospital staff continued to delay, treating him like a threat instead of a caregiver. This is the harsh reality of systemic racism in healthcare. It's not just about individual bias. It's built into the system, in policies and attitudes that put black lives at risk. Dr. Williams is not alone. Studies show black patients often wait longer, receive less pain medication, and face more dismissive treatment compared to others. Black healthcare workers, like Dr. Williams, face constant skepticism, doubting eyes, and barriers that their white colleagues rarely experience. But Dr. Williams didn't stay silent. He recorded parts of the encounter, shared his story on social media, and spoke with local news. His courage sparked outrage. The hospital issued an apology. They promised training and policy changes. More importantly, his story opened a conversation many were too afraid to have. This story shines a light on a problem bigger than one hospital or one city. Systemic racism in healthcare contributes to worse outcomes for black patients. Higher mortality rates, less access to quality care, and deep mistrust in medical institutions. But awareness is the first step toward change. We all have a role to play. Listen to these stories. Share them. Demand better training, better policies, and better respect for every patient and caregiver, no matter their skin color. Because healthcare should be a place of healing, not hurt, because every life matters.